What is systole in cardiovascular anatomy? Have you ever wondered how your heart pumps blood throughout your body? One key phase in this process is called systole. So, what exactly is systole in cardiovascular anatomy? Let's break it down. Systole is the phase of the cardiac cycle when the heart muscle contracts. This contraction is vital for pumping blood out of the heart's chambers. Specifically, it refers to the contraction of the ventricles, which are the lower chambers of the heart. When the ventricles contract, they push blood into the arteries. The right ventricle sends blood to the lungs through the pulmonary artery, while the left ventricle pumps blood to the rest of the body via the aorta. The cardiac cycle consists of two main phases: systole, which is the contraction phase, and diastole, which is the relaxation phase. During systole, the ventricles contract after they have filled with blood during diastole. This contraction raises the pressure inside the ventricles. When the pressure is high enough, the semilunar valves open, allowing blood to be ejected into the arteries. Ventricular systole has two important stages. The first stage is called isovolumic contraction. During this stage, the ventricles contract, but there is no change in volume because all the valves are closed. The second stage is the ejection phase, where blood is pushed out into the arteries. The process of systole starts with electrical signals from the sinoatrial node, which is the heart's natural pacemaker located in the right atrium. These signals spread through the atria, causing them to contract, which helps fill the ventricles. The signals then reach the atrioventricular node and travel through specialized pathways to the ventricles, triggering ventricular systole. This electrical activity can be seen on an electrocardiogram, where ventricular systole corresponds to the QRS complex. During systole, blood pressure in the arteries reaches its peak, known as systolic blood pressure. In healthy adults, this typically ranges from about 90 to 120 millimeters of mercury. The duration of systole is shorter than that of diastole, lasting roughly 1/3 of the cardiac cycle when at rest. As the heart rate increases, systole takes up a larger portion of the cycle. Understanding systole is essential for grasping how the heart circulates blood, delivers oxygen and nutrients, and removes waste products. It also plays a key role in clinical measurements such as blood pressure and heart rate, which reflected how well the heart is pumping and the overall health of the cardiovascular system.